I'm Jay, and this is my son Finn. He has agreed to be my volunteer patient for this video, and I give him permission to be in it. We will start with inspection of the skin. His skin color is consistent with his ethnicity. It is warm, it's dry, smooth texture, good turgor, and I do see some scattered nevi. Looking at his nail beds, they are nice and pink, no abnormalities, no clubbing, and he has a brisk cap refill of less than 3 seconds. Looking at his hair, he has a good hair distribution, soft texture, parting it in several different areas. I see healthy scalp, no flaking, signs of infestation or other lesions. And then looking at his eyebrows and his eyelashes, he has good hair distribution there, nothing unusual. He has overall good facial symmetry. His eyelids don't have any ptosis. There doesn't appear to be any lag or palsy going on. Let's see. His lacrimal and his orbital areas are free from swelling or abnormality. Is that tender at all in there? No. Okay. Let's see. Let's look at your ears. Ears. Inspecting the external ear and the tragus, pinna, and the mastoid. I don't see anything unusual. Is anything tender when I push on the tragus or on the mastoid? No. Okay. I'm going to look inside your ear. And inside of his ear, I see a normal amount of reddish brown wax. I see a pearly gray tympanic membrane with the malleus, and I see a cone of light at 5 o'clock. I don't see any erythema or effusion. And I would repeat that on the other side as well, and the cone of light would be at 7 o'clock on that side. Let's see. Oh, let me look in your nose. So looking at his nose, the nasal alveoli are not unusual. His right nair is a little bit bigger than the left. That can be a normal finding. Looking inside at his turbinates, they are pink. You're breathing on my thing. It's a little hazy. They were pink and moist and intact. And I would look in the other nose as well. Let me feel your sinuses. So your frontal sinus and your maxillary sinus. Is anything tender in there? No. You can just say no. No. His lips are pink, intact, defined vermilion border. Smile for me. Open your mouth. Stick your tongue out. Okay. Just gonna open it wide. I'm just gonna pull and look at your gums and all your teeth. Oops, sorry. So he's got good dentition. Nice healthy pink gums, and his tongue comes out at midline. Stick your tongue all the way out and say ah. Okay, when he says ah, his uvula goes up, which is normal. I don't see any erythema, any petechiae, or any exudate in the back of his throat, and his tonsils are 2+. Stick your tongue up to the roof of your mouth. Okay. And I don't see any lesions or plaques or abnormal vessel dilation in his oropharynx. That all looks good, thank you. Okay. And then let me look at your eyes. So looking at his eyes, the conjunctiva is clear. I don't see any icterus or injection. Be still with your eyes. His pupils are estimated at 4 millimeters. I'm going to shine a light in your eyes. I would dim the lights. And I am assessing for reactivity to light. And they're reactive. I'm going to turn my light off. I want you just to look here and follow it as it gets closer to your face, okay? Okay, and his eyes converge and his pupils constrict, so his accommodation is intact. I'm going to set my diopter to 0, and I'm going to shine a light into your eye, okay? I want you to look straight ahead, and I put my hand on your head and hold your eyelid open. So look straight ahead. Coming in from the side. I'm finding the red, keep your eye open, bud. I'm finding the red reflex, and I see a nice orangish, reddish retina, a sharp disc margin, and I don't see any AV nicking, any cotton wool, or vessel abnormalities in his eye. So turning that off. So now I'm going to palpate your lymph nodes. So the preauricular, postauricular, occipital, tonsillar, submandibular, and the submental. And I would have done that eye exam on the other side as well. And then feeling for the superficial, deep, and supraclavicular nodes as well. Okay, and then I'm going to look and see, close your mouth, look straight ahead. I see that his trachea is midline and symmetrical. I'm going to assess your thyroid. So I would find the cricoid cartilage, the thyroid cartilage, the isthmus, and then the right and left lobes. I'm actually going to have you turn this way, and I'm going to scoot forward a little bit. A little bit more. There you go. So I'm going to find those landmarks again. And palpate and just gently displace the trachea to either side, feeling for any goiter, enlargement. And on inspection, I did not see a goiter or any enlargement, so I'm not expecting to find any here, but this can be a little more sensitive to finding any of those nodules. And it's all smooth. I'm gonna hand you, can you sit so you're supported? I'm gonna give you a cup of water and I want you to drink it. So swallow. And I feel the thyroid go upwards and elevate, and that is normal as well. Okay, Finn. Why don't you go ahead and lay back again? Scooch up a little bit in the pillow. So we want you at a 30-degree angle. Turn your head slightly this way. Okay. So 30-degree angle, head turned slightly away from me, and I have tangential lighting to help view the point of oscillation. Kind of slump down, bud. Can you extend a little further? There you go. Scoot up higher. Okay, extend. So extend your neck, bud. I'm gonna place my ruler at external angle. Turn your head just slightly that way. And I see the point of oscillation. I'll line that up with my card. And I am at 0.75 centimeters. Less than 3 centimeters is normal in an adult. Thank you. And now I'm going to listen to his carotids. And I'm listening for bruit, and hearing none, I'm going to palpate, assessing for thrill, and I feel none, and I would repeat that on the other side. I'll now inspect his precordium, looking for any visible lifts. And I do not see any, so then I will palpate, and I'm going to use the pads of my fingers to assess for any heaves. Starting just to the right of the sternum and alternating on either side of it, and down the left side of the sternal border. And I would repeat that with the heel of my hand, assessing for any thrill. I am going to also locate the apical pulse at the PMI. So I'm going to find the midclavicular line, go down to that fifth intercostal space and palpate the apical impulse. And I have a regular rhythm and a normal rate. Now I'm going to auscultate. I'm going to start with the diaphragm of my stethoscope, and then I would repeat with the bell. So starting on the right at the second interspace, listening for the aortic, and then going to the left, and I'm listening for the pulmonic, and then going to the third for Erb's point, and the fourth and fifth area for the tricuspid, and then coming back down to that PMI for the mitral area. And I would repeat with the bell. I would listen for a mitral murmur, so I'm going to do that with the bell of my stethoscope. Okay. I'm going to have you turn on your left side. I'm going to listen at that PMI, assessing for a mitral murmur. And I do not hear one, so I'll have you sit up. Switching to my diaphragm. Turn your legs this way. So I want you to sit all the way up and kind of lean forward a little bit. Take a deep breath in. Right, deep breath in and exhale. Okay, and I'm assessing for that aortic murmur, and I do not hear one. So now I will do respiratory inspection. I'm looking for work of breathing, rate, rhythm. I see rate is within normal limits. I would count for a full minute in a pediatric. There's no sign of accessory muscle use, no respiratory distress, no retractions, any of that, no tripoding. And there is good chest wall expansion, symmetric. And so now I will go on to percussion. We'll do a tactile frontis exam. Okay, so I'm going to put my hands on your chest in various areas, and when I do that, I want you to say 99, okay?
99, 99, 99, 99.
And what I'm looking for is increased frontis. That would indicate some consolidation, and I don't appreciate any. Now I'm going to percuss. I'm going to tap on my finger on your chest, okay? And I did that on in 4 areas on either side, and I'm listening for resonance, and the resonance sounds normal. And now I'll listen to your lungs on the front. And I would just continue downwards in a ladder style fashion, moving from side to side in all of our listening areas. I'm going to actually have you turn around. We're going to do the same exam just on your back. So observing his work of breathing and all that from behind. And also we're going to do that same thing where I touch your back and we say 99, okay? So go ahead.
99, 99, 99, 99.
And that is normal. And then I'm going to tap on you again, okay? And there were 7 locations on either side, and that was resonant and sounded normal. I'll now listen to you, and I would complete that in all the same areas, moving side to side in a ladder style fashion. And now I'm gonna find the height of your diaphragm. So I want you to take a deep breath in and hold it. I'm gonna tap on your back, and I'm listening for resonance, and then the area of dullness will tell me where your diaphragm is. Okay, you can exhale and take a nice deep breath again. I'm just checking for expansion and excursion, and you have good expansion of your chest wall and symmetrical movement when you take a deep breath. Go ahead and turn, stick your legs out in front of you. We're going to check your peripheral vascular assessment. I'm looking for any signs of arterial or venous insufficiency, poor perfusion. So I'm going to start by checking a radial pulse, the brachial pulse, the femoral pulse, the popliteal pulse, the dorsalis pedis pulse, and the posterior tibial pulse, and I would repeat that on the other side as well and compare my findings. I'm also looking for hair distribution and then temperature of the extremities. I expect them to be warm, and I would also expect capillary refill at those distal extremities to be brisk as well, and also no signs of swelling, edema, or third spacing. And if there was any exam that would have been done on the other side that I didn't specifically say I would have done on the other side, I would have done that on the other side. And I think that completes my exam.